Hi, this is our group. We are looking at cognitive behavioral therapy for children with anxiety disorders. I am Austin Fontes.
I am Stasha Fowler.
I'm Brittany Garcia.
My name is Kathleen Francis.
And I'm Marissa Gardner.
All right, so looking at cognitive behavioral therapy, this is an evidence-based practice. It's a quite popular one in which we take a look at the way behaviors are affected by thoughts. And so the theory goes that when an event happens or a stimulus, it will evoke in us a thought, and given that thought, it'll elicit an emotion, and that emotion is what we will use to inform our behavior. So if we do something poorly at work and our boss calls us out, we might initially have the thought of, oh, I'm so bad, I did awful, I'm just the worst. And that is kind of a heavy thought, and that'll make us feel not so great and feel a little down on ourselves. And throughout the rest of the day, we're going to be carrying that mood, which will affect each of our behaviors that we do throughout the day. Whereas a cognitive behavioral therapist will try and challenge that thought. So we'll stop it at the thought. And instead of saying, you're so bad, you're so awful, it would be, no, you just made a mistake. And that's a little bit less burdensome, and it'll be less anxiety producing. So the idea is with less negative emotion, you'll be able to behave in a more normalized basis and not so informed by that anxiety. And so since we're looking at anxiety specifically, some of the measurement tools we'll be using is the GAD-7, the Beck Anxiety Inventory, the Penn State Worry Questionnaire, clinical severity ratings, and the Quality of Life Index. Studies have shown that cognitive behavioral therapy is extremely effective for not only post-treatment, but even in the many months to follow. So typically we'll see a big divide between the initiation of services versus the termination of services. And then again, on the 6-month follow-up, there's usually still significantly high results. And then again, on the 12-month follow-up. Cognitive behavioral therapy is meant to be a short-term format, so it's meant to really get people through treatment quickly. And so it's got that above other forms of treatment. Most cognitive behavioral therapy will last between 5 and 20 sessions. But they are definitely close-ended and goal-oriented rather than being so open-ended and lasting potentially indefinitely.
So when it comes to the strengths of CBT and the treatment of anxiety disorders, specifically such as generalized anxiety or social anxiety disorders in teenage children or adolescents, there are quite a few strengths that we can build upon. And I'll go into each one of them individually, but for now, I'll start off with just listing them. So the first one is that it's collaborative. It has a multitude of treatment modalities and methods. It's effective and it's accessible. Has, pertaining to its accessibility, multiple ways of the individual using self-help techniques. And it's considered a short-term form of treatment. So diving into the first bullet point, which is collaborative, cognitive behavioral therapy is a form of therapy that really relies on the strongly built rapport between the client and the clinician. It's educational in nature, and that once the rapport is built, the clinician is essentially teaching and working with the client to address their presenting issues or concerns and then adapting them. So taking this collaborative approach allows the clinician to integrate specifically the adolescent's individually developed goals into their treatment process. This is really helpful in engaging them, especially someone that's teenage age, as it gives them a sense of independence and control. Self-autonomy is a normal trait that adolescents are developing at that age. So the fact that CBT incorporates this is very helpful to the overall process. Many adolescents seek and value relationships that are with adults that aren't necessarily family members. So that falls right into the category of the clinician's relationship with the adolescent, working with the client from that position of a helping hand, and not necessarily the figure that most parents take on allows the client to feel a little bit more at ease in accepting this form of treatment. And so just these modifications that CBT allows for, it makes it a little bit more applicable to the teenage youth. And then going into the second bullet point, the multitude of treatment methods and modalities, I can dive a little bit deeper into that one. All therapeutic approaches really start off with the usual assessment or a review of what the client's automatic maladaptive thoughts may be, just like what Austin was diving into. Identifying the schemas they've developed and whatever stimuli they may be encountering at that time during your therapeutic process. But treatment, as I had mentioned before, really is adjustable and based on the needs of the client. So this means that some treatment approaches may be better received by some individuals versus other treatment may be more appropriate for other individuals. So they have a multitude of different modalities. So like group settings, individual settings, family settings. Some teens may respond better to group settings versus individual and vice versa. Some students don't like being in groups. And same when it goes to family settings as well. They might not feel necessarily comfortable in the family setting where they would prefer being one-on-one with the clinician. Internet is also another modality. So online therapy sessions are on the rise right now and can be done with the child. And depending on the age, when they come to a teenage years, they might not necessarily need as much oversight, but if the parent can be involved in that type of method of going through the CBT process, if other settings are not available, they do have internet access. So these are just a couple of the modalities of treatment. I can dive into other avenues momentarily. When I go into not necessarily the modalities, but the methods, CBT has many different methods. Again, that can be applicable for different individuals, different adolescents. It's really malleable so that, the student is able to get the process or whatever the approach is most appropriate for them at that time in their life. So there's stuff like the general cognitive restructuring. So, identifying the automatic thoughts and replacing those thoughts with more of a supportive line of thinking. You can also use other methods under the cognitive restructuring methods, such as like catastrophizing, which uses similar concepts. It allows the client to evaluate the likelihood of their imagined catastrophic event, develop the plan and really address the probability that would happen, and make a plan or a strategy to cope with the situation. Another thing under cognitive restructuring would be thought change records, which can address these automatic thoughts that the client or the adolescent may be experiencing in that moment. So it really can record that triggering event and whatever thought process they're having at that moment to change their line of thinking. So what goes hand in hand with this is another method, which is reciprocal inhibition. So that's reducing emotional arousal, helping the client experience positive emotion that counteracts their initial negative response to whatever situation that they may be in. Of course, it comes with practice. So the clinician will go with the client and through all of these different methods. And throughout time, it'll become a little bit more natural for them. Exposure is another big one. Repeated exposure for the client. It go through the physiological response and the emotional response. And then, after continued exposure, controlled exposure, they'll be able to control their response. So like imaginal exposure, in vivo, interoceptive exposure are just a few examples of those. In vivo is exposure that's like a gradual approach to places and objects. And imaginal is imagining a vivid image and going through the thought process of that with the clinician. Interoceptive is primarily used with panic disorder, but that falls under the category of anxiety disorders. So it's deliberately inducing that the physical sensation that they fear. Everything has to do with just changing your response to these type of stimuli. Thought stopping, that goes with kind of like the change records. But there's so many different alternative forms of treatment that you can use with CBT, and it really benefits adolescents in their ability to really improve their symptoms at that time due to its flexibility and the different treatment options that they can have. So going into the next point It has been found through numerous research that it can be appropriately used for a wide variety of anxiety disorders, like the ones we're talking about, generalized anxiety disorder, panic disorder, social anxiety disorder, things of that nature. There are many studies, countless studies that really show how effective this is. So there's a study that looks into a approach of CBT that involves like self-guided exposures. So that goes under the exposure category, where they use the imaginal exposure to repeatedly recount their stressors, and it decreases the severity of anxiety. It's been found to be effective through research. There is research that's shown that cognitive behavioral therapy, another form of exposure therapy, which is the imaginal exposure, increased functioning in generalized anxiety patients after 12-month follow-up. That is a study by Mr. Kazakirkin. And so it has been found to be more effective than other forms of therapy, like non-directive therapy. The same research dove deeper into other forms of exposure and how it's been effectively used for things like social anxiety disorder, changing the distortions in their line of thinking in social situations, and reducing just the overall symptoms of social anxiety. There is also CBT psychotherapy research behind that and its effectiveness. So there's really just tons of studies that prove effectiveness behind each different approach of cognitive behavioral therapy. They've done randomized control trials demonstrating that 2/3 of children who would receive CBT shown improvement, and rates are even higher when it can be combined with different forms of like medication too. One specific study that I wanted to dive into is that in 2009, 73 children participated to evaluate specifically the efficacy of CBT on childhood anxiety disorders, which is what we're really looking at. Two groups observed in the study, the control group, and then the children participated in the it was actually internet-based cognitive behavioral therapy, and parents were involved in it as well. So it was not necessarily considered specifically controlled since it was not in a clinical setting. But when they reviewed the results of the effectiveness, they saw through questionnaires, they saw pre and post treatment at 6-month follow-up that it really was showing that the longevity of its effectiveness was very apparent. And then I'm going to go into how it's accessible and has self-help points to it that is very positive. So it's one of the most accessible forms of treatment. The studies reviewed include accessible methods such as online treatment, in-person options for people that prefer more of those types of avenues. There's tons of self-help books that are available right now to those who want to use these strategies on their own. Stuff books like The Anxiety and Worry Workbook, The Cognitive Behavioral Solution by Aaron Beck and David Clark. So this really is like a guide that offers worksheets to the reader. So the reader can start reading the book and they'll offer them an avenue to practice what they're learning. So it's definitely very involved. Online treatment options, just like I just went through, are available, like computer programs called Beating the Blues, or websites like Academy of Cognitive and Behavioral Therapy. The programs, you can go in, it's a course, and you're able to engage with the course one-on-one, not necessarily a clinician. So it's really just dependent on you and your own willpower to get through stuff like that. And then it can be short-term. So right now it's considered one of the most effective short-term forms of therapy. It's present focus, short-term, and it allows adolescents to participate in sessions and at home as well.
CBT actually is great for anxiety. Some weaknesses of intervention are therapists that may lack skill and experience. Some techniques that they may lack, credentials and training, and that they don't do or don't have to do CBT. Some therapists will say they do CBT, so insurance will pay for them. Now we'll further discuss online therapy. Everything is changing now and everything is going online. Since COVID hit, a lot of appointments went online. Like example, telehealth is one of them. And the thing is, for teenagers, how can they actually get that full experience? The change of being in person, being able to express yourself more. Some kids cannot do that unless a parent is there or around. So if a parent is not around, it can make it very difficult for that therapy to be online.
The recommended population for this modality, CBT is a good modality for a lot of populations. It's good for school-age children, adolescents, young adults, and even adults in old age. The reason being is because it's kind of a simplistic form of therapy, but also it works to fix negative thought patterns. So that's the reason why it's good for so many different populations. Next slide, please. So for the cultural adaptations and considerations for cognitive behavioral therapy, some of those are that each culture views mental health and treatment in different ways. Some cultures kind of view mental illness or just depression, even like schizophrenia, things like that, as like somebody is cursed or they have a spirit, or it's caused by like them being hexed or haunted or something like that. And then in a lot of cultures it's something that's a taboo topic, and it's not talked about as much. So for the individuals that need therapy, or would benefit from help, they don't get it because they don't, out of fear of like being judged by their family or their community. Ways that the therapist can help in this situation is to incorporate the client's culture into therapy to make them feel more comfortable, maybe do like a family session if the family will, engage, just to make it more comfortable for everybody. Another thing that the therapist can do to help is to be culturally competent and to fully understand, why is this such an issue for the family? What parts of the therapy are they against? And how can we change things to make it better?
So group interventions, CBT groups can be both preventative and treatment. Research has identified that CBT groups with teenage participants are just as effective as individual sessions. Group participants will have the opportunity to share their life experiences, what has worked or not worked for them, and different perspectives of information learned throughout CBT. This supports how essential positive peer mentoring can be for increased commitment, supplemental information, and the reinforcement of skills. Recommendations to a group are made once an assessment is completed at an initial intake or referral, resulting in an individualized treatment plan can be put into action and goals can be identified. The patient will be provided psychoeducation based on the CBT model at first, then be given the option to possibly join a group that utilizes the CBT intervention model. When meeting with each prospective group member, providers must take into consideration the personalities and needs of each individual, predicting everyone will be a good match together. Group dynamics are essential to take into consideration. There is an increased risk of sharing privileged information about others when completing the program. Confidentiality and privacy are discussed at the initial group meeting, including but not limited to social media, sharing conversations that are private within the group, and information that is discussed within the group. For individuals with social anxiety, they'd have the opportunity to engage in their social exposures during the group. Even for others who experience challenges with sharing experiences with others that are unfamiliar to one another. Therapy groups normally consist of 6 to 12 teenagers, depending on the dynamic and needs of each individual. Group leaders identified how the practicality of groups makes it easier to schedule and support multiple patients at one given time. This allows providers to serve multiple youth at one time. The groups can focus on specific types of anxiety, including social, obsessive compulsive disorder, OCD, and panic disorder. For younger children, they can also focus on separation anxiety. In addition to treatment CBT models, there are also groups that focus on preventative interventions, focused on youth who may be at risk for anxiety. These groups often are located within schools and community settings. For example, one program is called the Friends Program. It is an integrated prevention program within schools using behavioral and cognitive strategies for children 8 to 11 years old. It consists of 10 weekly sessions, 2 parent-only sessions, and 2 optional booster sessions after the program has been completed. Parent-only sessions consist mainly of psychoeducation. Recent studies have evaluated the effectiveness of this school-based program of children between the ages of 9 and 12 years old. The results indicate a significant reduction of anxiety symptoms up to 12 months after the intervention. This prevention program can reduce teenagers and adults from developing anxiety that impacts their behaviors and quality of life.
These are the references we used. Thank you for watching.